All right. Well, I'll go ahead and I'll start by just giving a high-level overview of what we're working on now and our current developments. And as many of you know, we have two core developments. One is Humanta, and that's focused on optimizing the health of people. And the second is Metaplex, and that's focused on making care affordable to everyone. I'm going to start describing Metaplex first, and I'll circle back to Humanta. What Metaplex is, at a high level, it's a marketplace where healthcare buyers, such as patients, self-funded employers, anybody that has a need they need to purchase a solution for, they can come to this marketplace and find that solution and purchase it directly from a healthcare seller, such as a physician or a surgery center, a medical or diagnostic facility, labs, etc. And you come together and purchase it directly in a free market economy. So you don't have insurance weighing you down, paying you 45, 90 days later. Really starts driving the prices down because you can cut out all the overhead for billing. And you can kind of think of this as an Amazon for healthcare, for surgeries and treatments and procedures. Really innovative concept. If you start thinking about using the technologies we're using in terms of blockchain technologies, smart contracts, the ability to take your services, the health services, and tokenize them, it opens up complete new market dynamics. Really interesting stuff. So that's Metaplex, which is focused on really driving the price down of healthcare procedures. And the second that we have in operation now is Humanta, and this is focused on optimizing people's health. And we're doing so by incentivizing people to live a healthier lifestyle. And we're doing this by basically taking somebody's wearable, Fitbit. User can connect Fitbit, Apple Watch, various fitness apps out there, blood pressure cuffs, wireless scales, eventually EHR data, genomic data, microbiome data, everything about you. We're allowing users to connect to Humanta and generate a holistic view of a person's health over time and at a given point in time. And taking all these different data points to generate a health score for an individual, kind of like a credit score. And if this health score goes up or down, based on what you do, it can go up or down. And if you do increase your health score, you earn cryptocurrency, and it's called Metit. That's our cryptocurrency for Citizen Health. So essentially, we're paying people to go do healthy things, paying people to get more steps throughout the day, get better sleep at night, and just generally be more active throughout the day. So in that pursuit of health, they do generate a unit of value called Metit. And with this Metit, they can do multiple things, but mainly they can use this as a form of currency to purchase healthcare products and services from Metaplex, whether that's in full through various merchants or paying in almost like a discount token, kind of like your points on a credit card. So the idea is to focus on keeping somebody healthy and motivating them to be healthy, and they are generating value for doing so, and they can use that value to purchase care if they do so need on the marketplace. So tying all these in together, and we've been working on the concept for these for the past year. And the more we talk as a team, talk to physicians, talk to patients and employers, we're starting to see how these start to work together and how they form something new. And this something new is an idea we're toying around with called a health operating system. And this is a way where physicians can collaborate with the patients and also with other referral physicians. They can collaborate with the patient's caregivers, imaging facilities, labs, have all the data right there in front of the physician and patient. You can collaborate on that. The patient actually owns this data. They can give permission to the correct physician that needs it, and really opens up new modes of payment mechanisms, because we're going to be operating on subscription-based models and a la carte payment methods, and physicians get paid immediately, Uber style. The patient leaves out the door, get paid immediately. And also having communication layers in this where everybody on this system can collaborate and communicate together in real time, almost like Slack or Intercom for healthcare. So having all these concepts together, this is starting to look a whole lot like a better form of an EHR. And that's the point of this health talk here, is to hear more about, like I said, the EHR frustrations that you guys have and how we could build something better.
Yeah. Okay. If you go down this alleyway right by where your vehicle is. Yeah.
I'll answer. I'll stop there, and if anybody wants to chime in and just give your experience with the various EHRs you've used or are using, and what you hate about
them. I have a lot of experiences being a nurse. So before I got sick, I actually helped build an EHR. I was the team lead for implementing for our hospital, going from paper to electronic. And that I could say is one of the nastiest things that could happen. I mean, it needed to happen, but it was not pleasant. It was kind of going from the Stone Age to, the hunt and peck on the keyboard with the doctors. And trying to make sure that you were hitting all the legal requirements and still trying to have the workflow, have that process going still without interrupting everybody's day and without adding much time to that. And then I worked with several other systems as well. And healthcare has gotten to a point that there's so much legality involved that you're spending more time documenting than you are with your patient, which is not what healthcare is about, or is not what healthcare should be about. Let me correct myself. So, there's a lot of different systems, and I know that we're trying to streamline things, but there's so many different EMRs out there right now that a lot of them are bulky and inconvenient and aren't user-friendly, or at least aren't clinician-friendly, so that patient care can be the priority.
I'm curious what people think the mission of the EHR is, what its purpose is. For example, is it to make my background, I've done urgent care for 20 years, seen about 100,000, 110,000 patients, about half on EHRs, half on written records, familiar with Epic, and familiar with innovation within a large healthcare group. But one thing about electronic health records is I think the mission is not clearly defined. For example, is it to make a patient more healthy, and what do we define as health? In your system, it seems that health is measurable. Is it to be more efficient with billing? Is it to be a tool for a doctor to come up with a diagnosis? And those are separate and sometimes not compatible missions. And is it a back-end management tool for managers to track patient populations? And that was the principal function for Epic within our group. They wanted to look at population statistics. So I'd be curious what people think the mission of the EHR is and what your intent is in that.
This is Matthew Tabor. I have a personal question about that too. Was wondering if maybe you, as a physician, if you could possibly answer that question as well. My internist doesn't even know what the answer is. My internist is an academic. He is a clinical informaticist, which means that he loves IT stuff. He loves looking at data, but he cannot stand the EMR. He doesn't even know what the EMR is really supposed to be for. Every time I go in and see him for a physical, he'll sit down with me and I'll say, there's a computer in the room. He said, well, of course there is. And he's like, I think it's of the Dell Persuasion. And I'm like, you're not going to use it? He said, no, why would I? He said, why would I use something that's going to take up my valuable time with you? He said, you came to me. You're paying me to give you an H&P. You're here to see me. You're not here to see me in front of a computer. So why on earth should I use this thing in front of you? It's rude. So he's not a fan of the EMR too, but he has to because, if he wants to keep his job, he has no choice. And he's really, really upset too because his academic medical center just purchased Epic. And now, as a result of purchasing Epic, he's paying the price. His academic medical center is now having mass layoffs, and they're losing money badly for having implemented it. So I guess what comes around goes around. But still, again, I mean, you have an internist here that doesn't even understand what the EMR is for.
Well, I'd like to chime in and say I think it depends on where you're coming from, whether you're coming from a position as a physician or a nurse or a clinician as opposed to an administrator. I've nicknamed EMRs ERRs. In my opinion, they stand for electronic reimbursement records in the fee-for-service world. Now, I've got Dino Ramsey and Cindy Croy and Matthew. All of you are physicians, but I know Dino is a direct care physician. He gets his revenue on a subscription basis, and some other things certainly that he probably does in his practice. So I think that the focus of the EMR for Dino is a lot different. And I'm not sure, I don't think Dino and I ever discussed this about which platform he's on, but there are a handful of EMRs that are not reimbursement focused. They are direct care focused, and that automatically removes probably 80% of the difficulty that physicians today have with the traditional EMR.
Yeah, so I actually use my platform's Elation.
Okay.
I don't know who's heard of it. Yeah, obviously.
Yep, good
A
one.
lot of folks nodding. It's fairly easy to do things like coding. It's certainly very easy for documentation, very intuitive. It's not perfect. Certainly if you're doing pure, like DPC as it's purely envisioned, there's no need for any coding. But one of the things that I do is I work with a couple of employers, and oh yeah, it's a blessing because it gets me a lot of more patients. However, they've got these brokers that are trying to sell them on data analytics and other crap. And
Thank you.
I can understand some of that, but I think my goal in terms of what the EMR should be able to give me in Elation is still falling short. Is tell me how my hypertensives are doing. Give me a profile of the practice. Let me know how many of what diagnoses are out there. Of course, you've got to bunch them together. It's not as intuitive, just looking at ICDs or whatever method of coding you want. I've seen a couple of products out there. John, I don't know if you've seen KPI Ninja, which
Yes.
they're trying to do free text kind of tool to collect some of that information directly from charts, so you don't even have to worry about coding. But a lot of this stuff is a few years off. I mean, our tech in healthcare is really behind because of the reimbursement mandates. That's what everybody's concentrated on, and it's a total waste of time. But hey, it is what it is.
So it sounds like you're using the electronic health record. You'd like to use it for back-end data for your patient population. Do you tend to find that it's a useful tool for diagnosis?
Like improving the diagnostic process? Probably not. I think it's more a management issue. Like my particular community, turns out, has a fairly high, a higher than average prevalence of anxiety and depression, but it's really hard to get the numbers sometimes because, again, we do some ICD coding and it's just all over the map, so we haven't quite lumped them together appropriately. It all depends on what you're in the mood to type on a given day. So, but it's useful information to know that, because then you can actually do stuff that kind of targets the pathology in your specific practice. We don't have any diabetics. I think I got like 10 diabetics out of 2,000 patients. It tells you a lot. We have a lot more trauma. We have a ton of kids. So, one of our efforts this year, because of the number of kids, is we're going to create templates in Elation based on bright futures. So that way it'll be very easy for us to document that stuff. So, those are the kinds of things we're up to.
What other software products do you use to manage your practice? Probably Spruce, maybe Hint.
Yeah, we're kind of in that ecosystem. I know it's more expensive than the alternatives like Atlas MD, but like I said, I'm working with some employers, so I kind of have that need. Atlas in Kansas has a fair number of employers, and they're growing quite well, and they've just been more adamant about the way they're going to present data. I mean, ultimately, they're just presenting utilization, which is really the only thing the employers need to be concerned about. They need to be concerned about utilization and their downstream costs. So, having said that, yeah, we use the Elation Spruce hint, and we even use MD scripts for our medication dispensing.
Okay. How do you like Spruce? This is something that's fairly new to me. I've been following for a little bit ever since I saw him at the Hint Health Summit. Is that helpful? Because I talked to Michael Walker. He has New Care MD here in Mississippi, and he said that patients want to do everything through the Spruce app. They actually think Spruce is EHR in a way.
Yeah, I would say that as people become more familiar with it, they really gravitate to it. They love it. They want to make their appointments that way. They let us know about their refills that way. And because it's asynchronous communication, they can, as long as it's not urgent, they'll text me at 10 o'clock at night. I'm early to rise and early to bed, so I'll just pick it up at 5 in the morning when I get up. And they're happy with that.
It's kind of like intercom. Everybody's probably used intercom, see that little chat box at the bottom right hand of a lot of websites. You probably used it but never noticed it, but it's very similar to intercom, especially on the back end. You kind of have an ongoing dialogue with a user on a website. So if anybody's used our app, it's the actual communication we use for our app.
There is a physical challenge with EHRs in the room, and I'll tell you what I proposed to Microsoft about a year and a half ago, is when you're seeing a patient in the room, you are generally looking at the patient and looking at your screen and looking at the patient and looking at the screen, clicking in between, generally a dehumanizing experience. Yeah. And one possibility we started to play around with was to use a Microsoft Hub, a large wall screen, where instead of looking back and forth, you're communicating with the patient in one view. So it takes, I would contend that EHRs have become the center of patient engagement in day-to-day practice. And the idea of this was to take that center out of that and make it more a collaboration between the doctor, the patient, and the electronic health record, more like a triangle type system. So we did fool around with this, but for various reasons, partly because of legal obligations with the vendor, in this case Epic, which has a very big lock-in effect. There's not a lot of room for innovation once you lock into an EHR in a large medical organization. So there's an innovation cost with any of these electronic health records, unless they were open source. But overall, I would say that electronic health records make complex patients easier to manage, but easy patients more complex to manage. And so if you're an oncologist or you're a cardiologist, EHRs can be a godsend. But if you're just seeing sore throats and all of a sudden you have 50 screens to click through, it's a problem, and you'd probably be better off with a paper chart. So that's just one of my other observations.
In terms of your patients, it seems very one-sided now. It's really mainly focused on the clinician side of the work you need to do managing your patients. But at the same time, I think we're forgetting about the patients and the caregivers, how they interact with the particular treatment or procedure that they're about to go through. Is there a good way for you to collaborate back and forth with your patients and also with their caregivers that might be taking care of them?
Well, in a multi-specialty clinic, one of the greatest advantage of electronic health records is you have instant communication with the specialists, especially if you involve the EHR phone call. So it's very easy to look at an X-ray or look at an EKG with a cardiologist or an X-ray with a radiologist, or does this chest X-ray look like a cancer? And you're on the phone with a pulmonologist, literally within 3 or 4 minutes. So it's huge for patient management on that. But there was quite a debate on whether or not we should even open up the electronic health records to the patients. We eventually did. But does access to data on the EHR by the patient actually improve health? That's not an easy question to answer, and I don't know of any data that says patients having access to their data improves health. It's a good marketing thing, but whether or not it improves health is I think, it's an open question right now.
Yeah, I think data alone doesn't necessarily improve health. You have to have actionable insight on that data, because as a patient, you see your data in front of you. What are you going to do with that? What are you supposed to do to improve that?
Yeah,
it's really
you need
hard
to know what you're looking at.
Yeah.
There's a fine line between data and information, and the two rarely meet. So data to a physician is gobbledygook to a patient in a lot of respects. If it can be reduced to or improved to an information that the patient can understand, that's another story.
Mm-hmm. And Matthew, I'm going to answer your question about the mission for an EHR. And this is me personally, what I like to see in software, and I come from a background of solving business problems with software. If I see friction, if there's bottlenecks causing one department to lose time or spend too much time on certain things, you develop software to streamline those operations. So if you look at the flow and the operations through a clinic, just based through that lens, I would think an EHR needs to function as something that frees up your time and almost augments you to the ability where you can perform more or know more about your patient than you can actually read right there in front of you. For instance, what you mentioned, kind of a big screen on the wall where you and your patient can collaborate together, and you have a digital assistant kind of throwing information up on the wall, the trends in their health over time, maybe something on their genetics, the latest PubMed article that came out showing some relevance to whatever type of procedure they're going through or treatment. And using this software to really to save you time, to figure out your workflow and kind of work with you in terms of save you clicks. And what I really envision is you sit down with your patient and you talk to them face to face. You never have to touch a keyboard or a mouse because we have all these listening devices. Can't pull it over here. Alexa, all these other different.
Yes, I'm here. I listen once I hear the word.
I know you. And we have the technology now to listen to us and to detect our voice, and also to listen to our patient's voice to pick up on certain things that's going on that your ear might not can hear. And also with computer vision, you can start gaining a lot of insight to the patient's gait and various other things about a patient. So using these technologies to really optimize that time that you have with the patient versus that patient seeing half your face and you're clicking, and then after that patient leaves, you're still clicking. So that's how I envision the EHR to function. It's really like a tool to optimize that interaction between you and the patient, and also to function outside of the clinic. So when your patient goes home, they forget half of what you tell them. They can go back and they can communicate with you directly, whether that's asynchronous communication or whether that is just a record of everything that was said in that setting, in that particular visit. So having the ability for that patient to also bring in their caregivers to work together on this, because a lot of times your caregiver is going to ask you, well, what did the doctor say? And try to regurgitate what was said, and you miss half of it or get half of it wrong, and you start going down the line and you see where things can get off track. So using the EHR as a tool for everybody to come together to focus on getting a sick person back to being healthy, or if you are healthy, to keep you there. And that's my take on it.
Well, am I talking too much? I apologize if I am.
No, not at all.
I only had a little bit of time prior to this to prepare for this. Thank you for your Twitter, by the way. But I did actually, very interesting, because I did write down a list of the perfect EHR that's been floating around there. And first on the list would be charting free using voice AI, because we want to get off the keyboard. It would be highly visual and interactive in the room with the patients. It would focus less on diagnosis and more on therapeutics. There's a recent article in Nature magazine, very recent, I think 2 weeks ago, there's now an FDA-approved screening test for diabetic retinopathy in the office. So for only 50% of diabetic patients follow through in their eye exam, and the problem this intended to solve was, oh, the primary care doctors can pop these people in an imager and screen for diabetic retinopathy and then get them an appointment. But I'd contend that the EHR and the systems around it, diagnosis is not as important for a diabetic patient, and you know the diagnosis, as actual therapeutics. So you'd want an EHR that's enabled to ask it a question. Is it better to use amoxicillin or penicillin here? In terms of one of the risks and hesitancies to do that from a physician perspective is every time you click on a button or type something or delete something on an EHR, you have a liability with that, okay? Because you are either ignoring a complaint or following through a complaint. And so EHRs actually tend to be a liability risk imbalance for a physician because there is so much data. So I conceptualized a Snapchat type of EHR where the EHR can be used as a space to think through things without having worrying about where even that question presents a liability question to you. The open source software, because of the innovation aspects, the FHIR compatibility, where you're able to transfer files from Epic to Cerna or whatever you need there. The final thing is, so I'm on an Apple computer and I have an iPhone and I have an iPad, and there's a certain joy to working with those things, with the software. But, you know, I never once went into the office and said, what a joy it is to be working on this EHR to help this patient out. And finally, similar to what Jesse or what Dino mentioned, is that ability to review your prior evaluations of patients and get a private evaluation on your care. Is your care standard of care? In physicians, you have something called M&M in surgery, where you're able to kind of critically and privately assess accidents and mistakes on a case. So the surgeons all get together in a room and they say, you screwed up, you cut that vein, and patient nearly died. To be able to do that with your own EHR, so you become a better physician over time, would be an invaluable tool and should be AI enabled. But one thing we don't do is when a mistake is made, you know, you don't go jump in that chart and think things through and play around a lot. You certainly don't share it with other people. So a way to, and this is where I think things like blockchain may come in handy, if you're able to really privately review mistakes without being a liability issue for yourself. I mean, that would be like a valuable tool. So those are some of my ideas that I've been thinking through for some time. But it's going to be very difficult to go to these large restricted electronic healthcare companies and say, I like this. You know, I want this to be open source. They're just not going to, just not going to do it. So anyway, those are some of my ideas.
I really like that. Can we talk about the Snapchat concept a little more?
So let me think of a hypothetical example. I'm looking at a really bad sore throat, and I'm trying to decide whether this person has an abscess or not, okay? Or is epiglottitis. So I'm trying to decide between epiglottitis or an abscess or bad strep throat. And if I make the wrong call and that patient goes home, they could die. So I want to ask a question. Now, and I may not feel comfortable leaving the room, and I want to type in symptoms for epiglottitis. If I do that, and I put epiglottitis in that chart, and I do not fully pursue it, then I'm at risk liability-wise. And so it's very hard to kind of use a chart as a tool, because as soon as you document it, as soon as you put a word in, even if you delete it, then you have established that as something that you should have pursued. I've never been sued, but I've been on quality committees where we look through these EHRs, where every click and every screen is reviewed. And, it's a fairly brutal process. And so physicians want to have, they want to minimize what's on the electronic health record. Whereas from a back-end AI perspective, you think you should want as much data as possible to do deep learning or machine learning. So there is a conflict there. Also, sometimes too much data just confuses the picture. But that idea of like functionality that can't be tracked, you know, it's a nice idea. Now, whether or not something can truly be non-tracked, I don't know. That's your field. So,
I like that concept. I'm going to think on that one. But I really like that the number 7 I put down here, privately review mistakes. I do see that as being possible using blockchain technology in terms of removing all identity from this, having basically a token. You'd essentially turn that into a non-fungible token where you can pull this together and use machine learning and gain insight from that. I can see a lot of benefit for that. That's interesting. I like that a lot. So have you brought this to any, like you said, it'd be very difficult to bring this to an EHR vendor. I know you talked to Microsoft. Are they exploring their own EHR, or I'm sure they're exploring? Yeah, I'm sure they are.
I was a step away from meeting with the developers, and the lawyers got wind of it and shut it down. But Microsoft, I mean, there are definitely, I do know this, Microsoft is doing something in that area. I mean, I can 100% guarantee that. There's also a consortium. I speak sometimes at the Mayo Clinic for social media. And as you guys are probably aware, there is a consortium between Apple, the Mayo Clinic, and Epic. So those three are kind of now joined together at the hip. And probably some things will come out over that So I think that there might be something coming from that area too. But Microsoft is in Seattle. I had some insight into who was here. It was just an easy drive for me to meet with them. But I never was able to pin it down, and that was about 1.5 years ago.
I know they're working on it. But I will say we're kind of toying around this idea, and we're trying to formulate what this would look like. And then using the term health operating system in an abstract sense, because just an EHR, it doesn't fit for what I think we need, especially the electronic part. Let's just drop that. Like, it's understood for one. But we are starting with a handful of direct primary care practices to implement Humantive just for their patient population, just to incentivize and motivate their patients to be healthier, to go out there and just be more active and start to not necessarily track their health, but be able to visualize their health trends over time. And with this health score, we really want this to be a clinically validated health score based on a bunch of different metrics where you can prescribe something to a patient, and if their score increases or decreases, you can know, or you can better know that that treatment did or did not work. So that's where we want to go with that. We know we have a long ways to go with our algorithms. We just brought on a data scientist yesterday to help us work through some of this. But having the ability to watch that health of your patient fluctuate based on the inputs, so inputs and outputs. You know, whatever input you give them, this is the output, and start to measure that over the time. I think that would be very beneficial for physicians. I don't know. Really haven't run that by too many people in terms of how. I guess that would be kind of like assessing your number 6 in here, assessing how things went and how things succeeded or did not succeed with your assumptions. I don't know, Matthew, how do you think about that?
So first of all, using a health score, you're assuming that health is measurable. Okay, so that's a position. And I tend to think that's a relatively valid position. So health is not subjective, it's objective, at least for healthcare organizations. And there are some health scares. There are risk factors out there that are useful. So I guess your intent is an untreated diabetic is a 2, a treated diabetic might be a 7.5, and a treated diabetic that walks every day might be an 8.2. Okay, that's kind of your idea in a sense. Mm-hmm. And then you're using all those other things like genetics and cardiovascular disease and stuff. That is a huge idea. and it's a tough one. I think it'd be a tough one.
It is. Yeah.
Yeah. Even for something as simple as diabetes, it is hard to get people complying with medicines. I mean, so if I was going to do it, I would start on some really fundamental things, like, do you take your medicine? Okay. Maybe there would be one or two factors like hemoglobin A1C, but I would get but to worry about a health score in a diabetic who, where the focus should really be, is this patient compliant with his medicines? Is he taking his metformin or not? Is what we run into in the I don't know about the other doctors here, but that's usually my problem, is that simple compliance. Do you just take your medicine? But it's a big idea. I think measuring a health score would be a big idea.
So, Matthew, how does a health score, in your vision, differ from kind of risk adjustment schemes that have already been put out there and described?
I think you'd have to defer that to Brennan. Like a Framingham risk score, for example, something like that. A complete health score, which would factor everything in.
Well, there are tools out there in terms of risk adjustment and sort of looking at diagnostic risk. I think generally they're looking at what the risks are for large health expenditures, either same year or next year. And the correlations are actually really poor. I mean, the best risk adjustment tool, and I'm going to use some technical terms here, the best risk adjustment score has been able to predict about 60 to 70% of the variability in cost. Now, that's in Medicare patients. When you bring it down to the working population, the ability to predict the variability in costs goes down to about 30%. So basically, that's about as good as the state of the art gets. And I'm sure there's some management issues, sort of back to what we want to do as primary care physicians, is we want to be able to identify and manage those people who are at higher risk. Actually, Elation has a health risk score that's actually embedded in the EMR, so we can look at that whenever it's there, as long as it's coded by ICD.
But you know those patients anyway. Without the score, I would guess.
You usually do, but the score kind of adds a sense of urgency for some people. I mean, it's a reminder more than anything else. You can pull a report of your highest risk patients and go, dang, I haven't seen this guy in 3 months. I really need to see him sooner than that. So that's kind of where it helps.
Yeah, a lot of this helps too with the patient themselves, not necessarily on your side, but with the patient. They can visualize not necessarily how risky their risk score, but their actual health score, where they're trending, if they're trending up or they're trending down, and make adjustments based on that, where they don't necessarily need to talk to the physician. They can say, oh, well, I see that I'm getting less and less sleep, and it's causing my BP to increase a little bit. Let me just go to sleep a little bit earlier. So you can have actionable items to motivate somebody, a user, to do something a little bit different, to change up their day-to-day activities to improve that health score. So it's a little bit different of a concept thinking about it from the view of a patient, in terms of it's almost like gamifying health to them, having that score increase or decrease, almost just like a score on a video game.
And you would want to attach some type of currency or financial incentive possibly to that. Is that correct?
That is correct. Yeah, it's one of our cryptocurrencies, the ERC20 token. So we have a proof of health algorithm, and based on the fluctuation of their health score, they can generate a unit of value called Medit, and that's a cryptocurrency. And they can do various things with that. It has voting rights, it has certain privileges attached to it, and also you can purchase goods and services off Metaplex. And we do have a handful of physicians that are willing to accept Medit as not a full form of payment, but as a ratio of like 90% USD and 10% Medit. And physicians only can actually take that Medit and take it and stake it as a node in our network. So all the transactions on Metaplex in this marketplace, we're taking a small percentage fee of all those, and that percentage fee, that will be dispersed to all the token holders, the physicians, the nodes in the network. So it's a little more complex, probably different discussion. But yeah, we're creating an entirely new economy based on these new financial assets. Various crypto, we're having 4 different crypto tokens. I wouldn't say cryptocurrencies. One would be used as a currency. One's a security token. One's a health service token. It's a non-fungible asset. So there's a lot of different things we're doing using blockchain technologies and smart contracts. And if you want to take a deep dive into that, we definitely can. But it saves a lot of time, and it streamlines a lot of processes. It removes a lot of the back and forth paperwork, especially with these health service tokens. That's really interesting stuff.
So how would you, I mean, you can't really do premium discounts for people who are healthier, right?
Well, you could say if it's $100 a month. And
I thought there was a judgment this past year I don't think it was a Supreme Court. I think it was like a federal court of appeals decision that kind of shot down that idea. Matthew,
it was.
Well,
yeah, exactly. So it can't affect premiums, but I kind of wonder whether you could give, other financial incentives like, blockchain sounds to me like a good way to sort of give somebody a Starbucks card if they do well. Of course,
Starbucks is
Whole Foods gift card. That's what you need.
Well, yeah, you're right. And Starbucks, they're teaming up with, there's a lot of activity, but they're teaming up basically to create their own cryptocurrency, kind of like a rewards card, so they can generate their own loyalty crypto. But now you mentioned premiums, to get a discount on your premiums. What about a discount on your DPC subscription? Does that fall?
Well, as long as somebody else is paying me the full subscription, that's fine.
Yeah. Well, we're looking at a few employers are looking at us for this model to take Humantive and this health score and the ability to generate Medit as a form of employee engagement. They can go out there and just be motivated to do healthy things, and they can purchase Medit from us as the employer purchase it and then pay their employees for that, and have the employees pay you, say 10% in that, and the employer can reimburse you, something along those lines. Thought about that. But the idea is to really just introduce a new form of currency for health and wellness. And look at all blockchain technology. It's great. People think it's going to change the world, and it will. There's a lot of use cases for it, but let's not forget that it's a new form of currency. And this is the game-changing part of blockchain so far, is it is the next evolution of money. And it removes intermediaries from a lot of processes, and you can code terms and conditions into this money that take the place of a lot of the insurance processes, a lot of the claim processing. So it's interesting to see how it's going to play out, because we're still in the very early stages of this whole entire industry.
I have a question. This is Anthony. I know some of you, like Matthew, I know you from the Mayo social media side, John from the Twitter side of everything. But I'm newer to Citizen Health. I guess my question is on the Humantive side. Are you guys reaching out to just the general consumer population on this, or is the idea to get it into the direct care physician or a group, and then give that to their patient population from there? Or are you just trying to build up a huge audience around it first before going into that? What's your approach on that?
We're going to have a multi-phase approach to this. Right now, it's just the general consumer population. Just if you have a wearable, you can connect it, start earning cryptocurrency. But Lucent MD, we've talked to them, and they want to really offer it to their patient population. Just like I said earlier, just motivate, more incentive, more engagement with their patient population. And we did talk about Elation. Dino, I believe you said there's a spot for the health score, and we were talking about incorporating this health score into that place. I think we actually saw that link on there.
Right.
I don't know if they have an open API for that. But yes, move into DPC, into that arena. And also, we haven't approached employers yet, but we've got some feedback from employers wanting something like this. And we have an advisor on our team. He's an employer benefits consultant. He's pitched a few companies on this, and they seem to want it. So we have a little bit of tweaking to do to kind of move into that space, but it wouldn't be that difficult. But I see a lot of opportunity to engage not only patients, but employees too. I don't like to say patients because we're just people. Everybody needs to be healthy. So it depends on which bucket you're in at a given day. But it's to motivate people to be healthier is our main goal for that.
No, I mean, I really like it. With the gamification and everything, obviously, it looks really cool, and, going into like pirate metrics and all that other fun stuff. On the side, I'd be happy to talk to whomever about some things that I've learned from trying to get more of a general population involved first on like getting more people on board. I'd be happy to talk to someone about that, just because that's something that is really, I think, could be valuable, because this is an awesome, I love that side of it right there. So definitely something I'd love to hear.
Yeah, I would love to talk to you about that. And if you got time after this, I'm free if you want to continue the conversation.
Sure. Hold on one second. I'm having a note pass under my door. Hold on one second.
If I was just throwing something out there, I know you're looking at employers and the general population. You might also look at medical associations that have a behavioral focus. For example, the Obesity Medical Association, the OMA, has 2 or 3 big national conferences. And there you might tap in for preliminary, these highly motivated physicians, technically astute people, and see if they can work with these tools.
Great suggestion.
Because obesity is with the exceptions of surgeries and some of the medicines, much of obesity is behavioral management initially. So it's a relatively low risk thing to manage. It's the type of thing that could be managed with telemedicine most of the time. Unlike, say, diabetes, there's a relationship there, but diabetes is going to be much higher risk, particularly into things like insulin and cardiovascular disease and other things like that. So Obesity Medicine Association might be something to look at and get a sense of those type of people as an entry point for your technology.
That's a really good suggestion too, because I think a lot of people who are purchasing wearables, I think you have 2 classes of people that are purchasing wearables. Ones that want to start tracking their activity to lose weight, and people that are really active that just want to see how active they can be. There's really 2 camps there. So that's a great idea. I like that.
And you got the CrossFit group and the walkers.
Yeah. All right, everyone. Well, I like to try to keep these at an hour just to respect everybody's time. So if anybody else has any feedback, let's hear it.
Do you want to do feedback? Oh, sorry.
Sorry. Please go ahead.
Do you want to do feedback about the app right now for beta testing, or do you want to finish up this first?
Let's just finish up this, and I'll just end the recording, and then we can stay on. Whoever wants to stay on, we can. Yeah.
Okay, sounds good.
All right. Hey, Dino, you're muted if you just said something.
Yep. I said thank you for the opportunity. It's been fun.
Okay, well, thanks for joining us.
Dino, thanks for being here. Appreciate it.
All righty. Bye-bye.
All right, thank you.
Me too, Brandon. Thank you so much. And thanks for reaching out on Twitter today. And I'll send you guys an email, and feel free to contact me for any follow-up or anything you want. Okay?
Okay, well, yeah, thanks for joining on short notice, too. I appreciate that.
Yeah, it was a pleasure.
Okay, thanks.
Bye-bye.
All right. All right, everyone. Well, I'll go ahead and I'm going to stop recording now.